Assalamu alaikum everyone, and welcome to this week's journal club, where I'll be presenting a paper published in 2016 by Ricucci in the Journal of Endodontics, titled Apically Extruded Sealers, Fate and Influence on Treatment Outcome. The aim of this study was to evaluate cases of unintentional overfillings for the fate of the extruded sealers and their influence on treatment outcome. The materials and methods: the sample size was 105 teeth, and 75 of those teeth had apical periodontitis. Preoperative diagnosis was made, either vital or necrotic. The follow-up was ranged from 1 year to 4 years. Treatment was done by a single operator in his private clinic, and it was important to note that teeth with overextended gutta-percha points were not included. The working length was established at the apical constriction by using radiographs and an apex locator. The apical third was instrumented by using hand instruments, and no patency files were used. Irrigation was done by 1% sodium hypochlorite, and the author did not mention if they used an activation method. And vital teeth were treated in a single visit, while necrotic teeth were treated in 2 visits, with calcium hydroxide dressing in between those visits. Obturation was done using cold lateral compaction. Different sealers were randomly used, and they were zinc oxide eugenol based, resin based, and calcium hydroxide based. And after treatment, direct and indirect restorations were placed immediately after finishing the treatment. For the follow-up examination, at least 1 periapical radiograph in a conventional straight projection was taken, and additional mesial or distal angled radiographs were taken in cases with more than 1 root canal in the same root. For the determination of the sealer's fate, 2 experienced endodontists were blinded to the sealer used, and the examiners recorded if the sealer was present or not in the recall radiographs in comparison with the radiographs taken at baseline. Moving on to the results, at the 1-year follow-up, 3 cases from the tubally sealed group were examined, and in all of them the extruded material had completely disappeared. Complete removal was also observed for 43% of the cases, and 36% of the cases filled with PCS and PCS-EWT respectively. However, the only statistical significant differences at this period were observed when comparing the tubally sealed with AH+, Apexit, and endomethasone. At the 2-year recall, the number of cases in which the extruded sealer had disappeared increased for all groups, and no other significant differences were observed between the groups. At the 4-year evaluation, the statistical analysis showed similar findings to the 2-year recall. Significant differences were observed between AH+ and Apexit when compared with the other sealers, and no other significant differences were observed between groups. AH+ and Apexit groups were the material that was completely removed from the periradicular tissues. And so data from the 4-year follow-up revealed that 79% of the cases with apical periodontitis lesions at the time of treatment were categorized as healed, in comparison with 100% of the teeth with no apical periodontitis. This difference was highly significant, and there was no statistically significant difference in the outcome between the tested sealers at all examination periods. Moving on to the influence on treatment outcome, there was no significant difference between the different extruded sealers. Overfillings were not associated with a poor outcome in teeth without apical periodontitis. Disease associated with overfillings is usually caused by a concomitant infection and not by the cytotoxicity of the filling material. And overfillings are usually preceded by over-instrumentation, which may cause excessive enlargement and deformation of the apical foramen, making it difficult to achieve an appropriate apical adaptation of the filling material. In addition, it's important to note that teeth with apical periodontitis usually present with apical root resorption, and this may lead to deformations that likewise compromise the apical filling quality. The limitations of this study was, firstly, the disappearance of extruded salar on the radiograph does not automatically mean that it was completely removed from the periradicular tissues. The amount of the material and its density may have been reduced to a point that it cannot be discerned on a radiograph. Another limitation is the study's retrospective nature, which did not permit the authors to properly randomize cases for the type of sealer to be used, nor to precisely establish the set points for the organized recalls.